Good morning, everyone. My name is Suhaila Abu Awed, and today I'm pleased to present our work entitled Automated Breast Cancer Histopathology Imaging Classification Using Vision Transformers. This research looked at the simple question: can a vision transformers classify breast cancer tissue images better than the CNN models that are commonly used today? To answer this question, we developed a Vision Transformer framework, tested it on a public breast cancer dataset, and compared its performance with the three popular CNN models. This presentation is very straightforward. First, I will explain why this research is important. Then I will introduce our proposed model and explain how we prepared the dataset. After that, I will present our experimental result and discuss the elevation study. Finally, I will summarize the main finding and talk about our future work. Let's begin with the motivation behind this research. Breast cancer is one of the most common cancer in women, and every year millions of new cases are reported around the world. One of the most important factors in improving patient survival is early diagnosis. Today, doctors usually diagnose breast cancer by examining tissue sample under a microscope. This method is very accurate, but it also has some challenges. It takes time, requires experienced pathologists, and sometimes different doctors may give different opinion when examining the same sample. Because of these challenges, researchers have been using artificial intelligence to support the diagnosis process. Among these different AI models, CNNs have achieved very good result over the last few years. However, CNNs mainly analyze small part of an image. They do not always capture the relationship between different tissue regions, and this information can be important when making a diagnosis. This is where vision transformers become interesting. Unlike the CNNs, vision transformers analyze the image as a whole. They use a self-attention mechanism that allow the model to understand how different tissue regions are connected. Based on this idea, we wanted to investigate whether vision transformers could improve breast cancer image classification when compared with the traditional CNN models under the same experimental condition. Now let's look at our proposed model. The idea behind vision transformers is quite different from the traditional CNNs. Instead of analyzing the image piece by piece using conventional layers, the vision transformer first divided the image into many small patches. You can think of these patches as the small pieces of a puzzle. Each path is then converted into a numerical representation, and the model learns how every patch is related to the other. This is done using a mechanism called self-attention. The main advantage the main advantage of self-attention is that the model can understand both nearby and distant tissue structure at the same time. This helps it capture the all-over tissue pattern instead of focusing only on local details. In our work, we used the ViT/B 16 model. It divided each image into 16 by 16 pixel patch, processed them through a 12 transformer layer, and finally predict whether the tissue is being or malignant. To improve performance, we started from a model that was already trained on ImageNet 21K and then fine-tuned it using the breast cancer dataset. So for after designing the model, the next step was preparing the dataset. For our experiment, we used the Break His dataset, which is one of the most popular public datasets for breast cancer histopathology research. It contained almost 8,000 images collected from 82 patients, including both benign and malignant cases. The images were captured using different microscope magnification, making the dataset more challenging and closer to real clinic practice. Before training the model, we applied several pre-processing steps. First, every image was resized the required input size. Next, we applied the stain normalization to reduce color difference between tissue sample. This is important because stain process may vary from one laboratory to another. Finally, we used several data augmentation techniques such as flipping, rotation, and brightness adjustment to help the model learn from diverse examples and reduce overfitting. To ensure a fair evaluation, the data set was divided into training, validation, and testing sets, while making sure that images from the same patient never appear in a different group. Now let's move to the most important part of the presentation, the result. Here we compare our proposed vision transformer with the three well-known CNN models, VGG16, RESNet50, and DEN DenseNet 1-to-1. As you can see, our model achieved the best performance across all evaluation metrics. The overall classification accuracy reached 91.4%, while the AUC reached 96.7%. Compare with the strongest CNN model, which was DenseNet 1-to-1, our approach improved the accuracy by 2.3% point. However, the result was considered the most important is the 89.9% sensitivity. Why is that important? Because sensitivity means how well the model detects cancer cases. In other words, our model correctly identifies almost every malignant sample in the medical diagnosis. Missing a cancer case can have serious consequences. Therefore, achieving a high sensitivity is very encouraging result. Overall, these results show that vision transformers can capture important tissue information more effectively than the CNN models evaluated in the study. Before finishing, we want to understand which part of our framework had the biggest impact on performance. To do this, we carried on a elevation study. In simple terms, we removed or changed one component at a time and observe how performance changed. The first experiment was stain normalization. When we removed this step, the accuracy dropped the most. This tells us that reducing color difference between tissue sample is very important for achieving reliable result. Next, we looked at the effect of pre-training. Using a model that was pre-trained on a large ImageNet 21K dataset give a better performance than using ImageNet 1K. This shows that large-scale pre-training helped the model learn stronger image feature before fine-tuning. Finally, we tested different patch size. We found that using 16 by 16 patch worked better than large patches because they preserve more detailed information about the cell. Overall, this study confirms that each design choose contributed to the final performance, with the stain normalization having the biggest impact. Let me now summarize the main point of this work. In this research, we propose vision transformer-based framework for classification breast cancer histopathology images. Our experiments show that the proposed model performed better than the three CNN models, including in our comparison. It achieved an accuracy of 91.4%, together with a 96.7% AUC, showing that vision transformers are a strong choice for this task. Another important finding that the stain normalization play a major role in improving the performance. This reminds us that good data preparation is just as important as choosing the right deep learning model. Of course, this work still have some limitation. At the moment, our model only performs binary classification, meaning it predicted whether a sample being or mangling. In addition, all experiments were carried out using a single public dataset. In the future, we plan to extend this work to multi-class breast cancer grading, evaluate the model on a large and more desired diverse dataset, and explore techniques such as feature learning and self-supervised learning to further improve performance and make the system more suitable for real clinic applications. This brings me to the end of my presentation. Thank you very much for your time and your attention. I hope this presentation has given you a clear overview of our work and its main contribution. I would be happy to answer any questions. Thank you.